Endometriosis is a common condition affecting 1 in 10 women in the UK of childbearing age. That's approximately 1.5 million women in the UK who are living with endometriosis and having to put up with significant pelvic and abdominal pain during menstruation, painful intercourse, and spontaneous pain outside their periods. In some cases, it can lead to infertility issues, and in fact, the prevalence of endometriosis in women with infertility is 30 to 50%. Women with endometriosis are facing serious delays to diagnosis, with nearly 2/3 visiting the GPs over 10 times, a quarter visiting doctors in hospitals 10 times or more, and over half ending up in A&E due to their pain. It takes 8 years on average from onset of symptoms to receiving a diagnosis, the same length of time as it did a decade ago, and this highlights an urgent need for investment in research to drive down this time and ensure appropriate access to care when women need it. Currently, diagnosis using a conventional imaging technique isn't always possible, with keyhole surgery, also known as a laparoscopy, being the present gold standard way to reach a definitive diagnosis. However, this is an invasive procedure, meaning that it can either lead to years of uncertainty for those that have endometriosis but are reluctant to have surgery, or unnecessary surgery for those that are eventually shown not to have endometriosis. Our sincere hope is that this study will bring about the development of an algorithm to enable diagnosis through minimally invasive approaches, and this would be a huge step forward for women with endometriosis symptoms. This is a complex process where we have to bring together 2 different imaging modalities, ultrasound and MRI, along with the clinical symptoms that women present with, and then verify our findings on the subsequent surgery that they have. Once all the complex data has been collected, our technology partners, Perspectum and GE Healthcare, will start looking at and comparing the data sets.
The funding from Innovate UK has enabled us to recruit women to our study to this groundbreaking blue sky thinking project, which is currently showing extremely good results. We're demonstrating that these endometriotic lesions have their own interesting signal. What we're hoping to produce is a heat map that can then be read quantitatively, demonstrating where there is a potential likelihood of endometriotic lesions. And this should both reduce interoperator variability, i.e. the ability of the radiologist to read the scan, but also reduce radiologists' time in having to look at the scans if we can do this in an automated fashion using artificial intelligence. And therefore, we will reduce the cost and the time associated with women having MRI scans and hopefully lead to a better pathway to diagnosis in the future.
Surprisingly, one of the research projects that I've got 100% recruitment rate, purely because every patient that hears that they were doing research on this to try and identify endometriosis earlier through less invasive techniques are all on board of it. The patient's experience, of course, is that they're very keen to understand what can we do? How are we going to make that difference? Will I find out the results of the impact of this research later? They recognise it won't make a difference for them then and there, but they have no problem with that because they know it's going to make a big difference to the wider generation of women. At the end of the day, if they had an earlier diagnosis through a less invasive technique, they potentially may not have had to suffer the consequences of the development of the disease and therefore the downstream potential of having the infertile consequences of endometriosis.
Endometriosis is a very varied condition. It can be anywhere from just a little speck of a disease all the way to very, very significant deposits of endometriosis and everything in between. And also symptoms don't always go hand in hand with what we find at surgery, but also frustratingly, it overlaps with a lot of other things, and trying to understand what is incredibly difficult.
What we're hoping to provide is a simple, non-invasive test that women will be able to have at an early stage in that diagnostic pathway. If that becomes adopted across the healthcare system, we aim to reduce the wait from 9 years for a diagnosis to more like 1 to 2 years. And this should significantly improve the lives of the women affected by this condition.
what I think is great is that through understanding and working together how data can be moved around, how different types of entities can interact, we've effectively laid the pipes and the foundations for future innovative companies and technologies developing medical imaging to work through that process. And the goal is accelerate this for future technology. That, I think, will be a great legacy of this project, not just in raising awareness about medical imaging and the power of AI and software solutions, but actually laying a pathway and establishing what good looks like.
If every single person says, I want to help because I don't want this to happen to anyone else, it means that we need to do something. And hopefully we will. That's the whole point of a collaboration like Defend through NSIMI, bringing together expertise from different fields, technology, medicine, and with very generous funding from Innovate UK. And I hope that we're going to come up with something that will be worth funding for even many more years to come.